Good afternoon. This is the special broadcast coverage of the coronavirus crisis using the combined forces of TV5 and Signal TV's One News, Radio 5, and 1PH. Also joining us on occasion will be our One News partners from the Philippine Star and Business World Online. We have Pat Mangunit live with us from reporting from EDSA Santolan. Pat, what's the situation there?
Yes, Ed, around 600 taxis were held and stopped from flying EDSA after the PNP Highway Patrol Group flagged them, since all public utility vehicles are no longer allowed to travel here in Metro Manila after the enhanced community quarantine for whole of Luzon. And now the drivers are also complaining that their income will be affected after they were held here since 8 a.m. this morning. And they were also asking or clamoring that the government give them at least the same amount of their income that will be lost due to the quarantine. But now the Highway Patrol Group has also already decided to release them after processing the IDs of the drivers, the plate numbers, and the company names of their taxis. Ed?
Well, Pat, what do we expect to happen from this? Have they been apprehended? Will they be issued tickets, or will they just be given warnings? They've been there since 8 o'clock in this morning. It's been 4 hours. So is this just a warning of some sort?
Right. The PNP Highway Patrol Group Director, Brigadier General Eliseo Cruz, has explained that after 4 hours, also of coordination with LTO and LTFRB, they will instead be giving warnings to these drivers, since they're no longer allowed, for violating also the guidelines of no longer being allowed to travel in the streets of Metro Manila. The PNP HPG will submit a written report. They will list down all these taxis apprehended today. They will take the names of the drivers, take a photo of their driver's license, and then submit the list for proper discretion of the LTO and the LTFRB. And eventually, one by one, these taxi drivers will be allowed to go home. So this warning will give them the signal that they should no longer be taking passengers starting tomorrow or even after today until the quarantine is over. Ed?
Okay, Pat, so clearly they're cracking down on public utility vehicles, at least on EDSA, that are still trying to ply their routes despite the quarantine. Now, what about, for example, buses? Do you have any examples of buses in EDSA that have been pulled over?
Yes, Ed, we found just a couple of buses also stopped by the PNP HPG, and they were also held here just along EDSA Santolan. But the same process will be done to these buses, and they will eventually be released. Ed?
Expecting the same kind of strict enforcement, not just on EDSA, but everywhere else in Metro Manila, at least speaking for the HPG here in Metro Manila. And likewise, what about the rest of Luzon? Is the HPG also going to crack down on all the other PUBs and PUJs throughout Luzon, which is what, like 8 provinces?
Yes, Ed, the PNP HPG has already ordered all other regional highway patrol units in Luzon to do the same, monitor public utility vehicles who disobey the guidelines and are still continuing to take passengers and travel the streets. But after this, they may, if they have anyone else to apprehend after today, the PNP HPG is warning that an impound may already be imposed. Ed?
Okay, well, Pat, let me just try this. I don't know if you have the answer for this, but let me just try this anyway. We understand that some local government units, for example, the case of Pasig Mayor Vico Soto, earlier tweeted that his city is going to allow tricycles to continue plying their routes because, basically people who have to go out to do essential things have no way of going around if they don't have any vehicles. I'm wondering if in the case of, for example, tricycles or any other public utility vehicles, is there any leeway being given to the authority of LGUs. In other words, pag nagbanggaan yung otoridad ng LGU at ng HPG, sinong mananaig?
Well, right now, Ed, the PNP-HPG says that when the guidelines were given to them, that would also include jeeps, buses, as well as tricycles. But so far, here in major thoroughfares, the HPG is inspecting. No tricycles have so far been apprehended. For the LGUs, they still don't have any details on which specific LGUs or cities or municipalities will basically allow or regulate the use of the tricycles as of the moment. Ed?
Pat, any idea kung meron pa silang ibang checkpoint, I mean, yung HPG, dito sa Metro Manila? Or is it just in EDSA?
Initially for today, Ed, it's just in EDSA, but they said they will also be monitoring C5, Ortigas Extension, and other major highways in the following days. Ed?
Okay, maraming salamat. Thank you very much. That was Pat Manguni reporting live from EDSA Santolan, where the authorities are now cracking down on PUJs and PUBs that are still plying their routes. And also now with us to give the latest updates over in Valenzuela City, we have on the phone Mayor Rex Gatchalian. Mayor, good afternoon and thank you for joining us.
John, good afternoon, and thank you for having me, and thank you for the invitation to be heard by your listeners and watched by your televiewers.
Yes, sir. It's a pleasure to have you here, sir. Tell us about the situation there in Valenzuela. You're basically you're a border city. I mean, bordering Bulacan.
Well, Valenzuela is the northernmost city. To put it simply, this is literally the gateway to Metro Manila
Yes,
from
sir.
the north. Last night we had I think a lot of people saw in the social media feeds. Last night there was some type of miscommunication, I guess, between the police of the NCR and the police of Bulacan.
In Bulacan.
Remember, anything going into the city is the jurisdiction of Valenzuela. So we're manning the lanes, the LGU together with our local policemen. We're manning the lanes coming into the city, which thereby coming into NCR.
Yes, sir.
But when you are now leaving NCR, you cross the bridge, you get to Maykawayan. The authorities there are under the Maykawayan city government as well as Bulacan's police force. So you're talking to very different entities. So last night, because of the checkpoints, there were a couple of delays. The lines were long, the traffic line queues were long. May mga naabutan. Some people were actually stranded in the bridge because at 12:01, the Bulacan policemen
Lockdown na.
interpreted the order as lockdown, which I don't blame them because they're following the instructions to the T. But of course, we also have to remember that the people who were queuing, it's not their fault. They were in the city, they got caught in traffic, and they shouldn't be made to suffer and not be able to go home because sila yung malas na inabutan ng 12:01.
Opo.
So there were a couple of incidents where there were people stranding, milling around, converging around the bridge area. So we had to intercede and talk to the Bulacan police to allow them for humanitarian reasons because it's already 1 in the morning. Also, social distancing wasn't being practiced anymore. And also, again, these are exceptions to the case because it wasn't their fault. They were in queue already as early as 7 p.m. But today, I think things are more smooth because there's less cars crossing the bridge. Only those that are working for medical practitioners, the exemptions provided. There are no more public utility vehicles coming in and out of the two cities. So it's more manageable now. It's just a matter of some people who are hard-headed, who still are not part of the exemption list, wanting to come into the city or NCR.
Tsaka po yung kagabi, I suppose yung kagabi, mga taong pauwi sa bahay nila. And if you prevent them from going home, you're actually working against
exposing
the
them
quarantine.
to more danger, yes. That's why even if they're not Valenzuelanos, remember, they're all leaving the city, so they're not my constituents. At this point in time, it doesn't matter whose constituent they are anymore. At this point in time, we are all Filipinos trying to fight this virus together. I'm not blaming the PNP of the country because they were just following instructions to the T. Alam mo yon, Jun, yung parang minsan when in doubt, you just follow.
Yes, sir.
So they're not allowed a lot of leeway. I'm not justifying their actions, but I'm not also accusing them of doing anything wrong. They were just faithfully doing the responsibilities. And siyempre, hindi naman sila binigyan ng discretion na, okay to, hindi okay to. So I guess we had to intercede because we wanted people to be safely in their homes, and to stay out of the streets. Di ba yun ang mandate niya ngayon eh? Everybody stay in.
Yes, sir. Yes, sir. Actually, sir, which also brings me to another question. Well, from what you've seen, at least last night and early this morning, does it look like the quarantine is now being implemented in a more stricter fashion compared to the previous days?
Twofold. Yes, stricter, but the second fold is more people because the work schedules have been canceled. People also saw how what happened yesterday. So a lot of people are actually, I would say, not all, but a lot more are heeding the call of the president to just stay at home. So that's also a big factor. And them canceling the public utility vehicles, that's also another big factor. So I can say there's no perfect operationalizing in just one day, but at least now we can see so much more better flow and management of the checkpoints.
Yes, sir. But at the same time, with the cancellation of the transportation, the mass transportation sector, how are people able to move around if they belong to an essential sector? For example, health workers, people who work in groceries and all
the
that.
standard that we're following. Right now, I'm actually on my way to meet all the health practitioners, the hospital administrators, both public and private. The city government worked out an arrangement with their local PNP wherein we will issue certifications. That will prove that these people are actually workers of a healthcare industry partner, meaning
In your city?
in our city. Now, if they cross the city borders, I would assume the mayors will also recognize that. So, diba, Jun, in everything naman, there's room for improvement. I think the system's getting better and better as we go along.
Yes, sir. But, sir, but the problem still remains that a lot of these people probably don't have any transportation. And
No, but from my interpretation, they can bring their own cars, carpool. Their hospitals can set up, if they're working for private hospitals, they can set up carpooling systems. Like in our case, given that City Hall's 80% closed anyways, all government vehicles are now being mobilized to do Operation Sundo and
there you are. Yes, sir.
Of all our medical practitioners in the public sector.
Yes, sir.
Now, later on, I will be talking to our private practitioners, telling them, look, why don't you just organize the same, use vans, but practice social distancing, and we'll certify those vans so that they don't get caught.
Yes, sir. Actually, that's one thing that some people are asking about. Our local and national agencies putting together, some sort of transportation,
government-run public transportation system.
Yes, sir.
We're doing it only for our public healthcare providers at this point. But I'm going to now, like I said, I'll be talking to the private healthcare practitioners and tell them to organize the same, and will ensure that those limited number of vehicles are certified so that the policemen won't catch them.
Yes, sir. Yes, sir. Now, one more question. The president last night said that he's leaving it up to the local government officials, in particular the barangay captains, to make sure that nobody goes hungry during this lockdown. I suppose he's referring to the fact that, number one, there's less travel allowed. People should not be leaving their houses. Only one person is allowed to go out to buy food. And you'll possibly have a lot of sari-sari stores and karinderias not being operational. So mahihirapan yung mga tao na walang pera, kaya walang trabaho, at walang sasakyan na umikot at maghanap ng pagkain. How is this being handled, sir, in your city?
We're mobilizing now. Actually, we're talking to DSWD. This will be a joint effort between the national government, local government, and the barangays. We already met the barangay captains. We're going to use our quick response funds to reach the poorest of the poor or the most vulnerable. What base list are we going to use? Number one, the 4Ps. Because if you remember, the 4Ps list are the most vulnerable, and that list has been cleansed, purged, upgraded over the years. So that's a good base list. Number two, the city has a census of our pockets of poverty. These are informal settler enclaves inside the city. We actually have census of how many families there are. Right now, the barangays have tasked to do counts of apartment dwellers. Because remember, our city is a industrialized city. We have a lot of minimum wage earners, workers.
You have a lot of
and they are normally tenants of, they may not necessarily live in informal settlements, but they are in apartment complexes. Right now, our barangay officials are doing a tally of how many of these near poor, we call them the near poor, that are minimum wage earners living in apartment dwellings So they're now doing door counts as we speak.
Yes, sir. Yes, sir. But I don't know if it's too early to ask you, but would you have anything in mind as to how, for example,
How do we dispense the food?
yes,
We've
whether it's
already
food or
gotten
money,
that far. Money or the food?
whether it's food or money, sir.
We're giving out, our concept is food packs, good
Yes,
for
sir.
7 days for a family of 4. That's how we do it all the time whenever there's calamities. We have delivery trucks of the city. We have 10 of those big military type trucks that we use during calamities. We're loading them up with the goods to be escorted by police escorts because we don't want people thinking that they can do something to those trucks.
Okay,
And
dampot
then
lang.
together with the barangay officials, we'll do door-to-door knocks. It will be, June, every Christmas and every summer we do rice distribution for our senior citizens. It's so easy because we converge them in drop-off points. But because there's no convergence now, we will have to painstakingly do it one by one, door to door, and that's why we need an accurate door count as we speak.
Yes,
So
sir.
the goal there is by tomorrow we should be able to dispense some type of assistance, and that will hopefully last for another 7 days. Then we'll do it again and again and again. But June, let me also raise the alarm that yes, we are a fairly big LGU. That's very true. We can probably handle a month or 2 months worth, given the number of families we're talking about. But the we will really need national government support, and they've already committed. Actually, we were on the phone with them this morning to also help us augment our food supplies. Because remember, our Valenzuela is a mid-sized city, but you also have to think about the small-sized cities. What about them?
Yes, that's correct. Actually, sir, it does make sense that you distribute food instead of money kasi kung mag-distribute ka ng money, mahirapan na silang bumili ng pagkain.
Exactly, and we don't want them to leave. So what we're going to do, the system is delivery trucks, those huge trucks, we have those, 10 of those, running around the different pockets of poverty in apartment complexes. Then we have barangay workers and social workers doing the knock door to door. Of course, practicing social distancing, probably leave the package in front and tell them to pick it up when we've moved on.
Okay, sir. But that does sound like a major task.
It is, June. That's why I've been hunkering down, trying to get a clear census of what daunting task. But it's not, for instance, the number we're looking at, 4Ps is 12,000. Pockets of poverty around additional 5,000 more families. Because remember, all pockets of poverty should be included in the 4Ps list by now. So we're looking at a rough figure of around 12 to 15,000 families. So you won't do that all in one day. Of course, that's virtually impossible. But given that those food packs are good for 7 days, I can do them in phases and then do it again after the 8th day.
Yes,
It's a cycle.
15,000 families, that's around, if you go by a family of 5, that's 75,000 people.
Yep, but we know for a fact that that's not all of them. That's why, remember, those are the 4Ps. We have 12,000, pockets of poverty around 4,000 to 5,000. But we're doing a door-to-door census of the near poor, meaning these are minimum wage earners who do not live in informal settlements but in apartment complexes. Now that's why we need to do the census there, because remember, our workforce is migratory in nature in Valenzuela. They work here for 6 months and they're gone after a couple of months. So what we're doing now is the number of door counts. It doesn't matter who lives there. As long as there's a family that lives there, we will give you the food back. That we're still consolidating the numbers now.
Sir, I'm sorry. Let me squeeze in one more question. Earlier today, we saw a tweet by Pasig Mayor Vico Soto, and his point of view is that as the mayor, he has the authority to allow tricycles to continue plying their routes. Kasi sabi niya, walang ibang masasakyan yung taong bayan na kailangan
June,
gumalaw.
I took my cue from what Mayor Vico also did, because last night that was our gut feel. So right now in Valenzuela, there are some, not a lot. We spoke to the operators, just ones that will ferry our health workers, people working in the food industry, just to provide some sort of minimal public transport. That's what's happening right now.
Yes, sir. Okay, maraming salamat po.
June, thank you.
Mayor Rex Gatchalian of Valenzuela City, maraming salamat po. And to expound on the scope and limitations of the enhanced community quarantine in Luzon, we also have on the line Interior Undersecretary Jonathan Malaya. Yusek Malaya, thank you for joining us.
Yes, Ed, and thank you for inviting me.
Yes, sir. It's a pleasure to have you here, and thank you for giving us some of your time. I know you're very busy, sir. Let me start off with the quarantine itself. The quarantine's been expanded from Metro Manila to the entire mainland of Luzon. So, in effect, are we looking at closing the ports? For example, the Matnog port and the Batangas port, and all the other ports that flow towards the Visayas.
Yes, we are. But just to clarify, it's not simply the mainland of Luzon. The entire political units of Luzon is
Oh,
part of it.
that
So that
includes
would
Batanes,
include
I
region,
suppose, and
region
Catanduanes.
4B. Yes, Batanes, Catanduanes, Masbate, and the island province of region 4B, which is Mimaropa.
Mimaropa.
So that would also include Palawan.
Yes, sir.
No? And
And Mindoro.
Mindoro. So, yeah. But of course, we have an assessment on a regular basis. So maybe in some areas which are really isolated and there are no reported cases of any positive COVID-19 incidents, then it's possible that it may be raised. But that would all be dependent on the Department of Health.
Sir, that's going to be quite a challenge to manage. You're looking at 53 million people or more in a quarantine area.
That's right. That's why we really are urging the local government units to take a very active role in ensuring that it's complied, no? Because the national government cannot do this alone. On the local level, it's going to be the barangay and the mayor who's going to make sure that people stay in their homes, that they do not go out unnecessarily, that only one person will go out and get food. Now, to respond also to the needs of indigent families, the president already declared a state of calamity over the entire Luzon. So the local government units can now use their quick response fund
Yes, they have
for
access.
them to access that amount and that fund, for them to buy financial assistance, no? to buy food and provide financial assistance to indigent families at this time of need. Now, if the LGUs find that their funds are not sufficient, they may request augmentation from the DSWD and the DOLE and the DTI. And the DSWD yesterday was given the instruction by the president to start preparing food assistance, no? Just like what government does when there is a natural calamity.
Yes, sir. Sir. Yes, sir. Sir, one more point of clarification. Well, it's quite clear, at least from the instructions yesterday, that PUBs and PUJs and UV Expresses and TNVSs will no longer be allowed to operate because of the quarantine. However, some questions by a lot of people who appear to be stranded out there right now, including people who may belong to the essential sectors like the healthcare sector and manufacturing or food processing sector, who are not able to get rides anymore because of, they basically don't really have any private vehicles.
Yes, that's correct. We also monitored that situation. And in behalf of the Department of Interior and local government, I'd like to apologize to all of those individuals, no, who are clearly exempted from the ban and yet are being turned away. These are first-day kinks, no, what
Yes, sir.
people call as birth pains. We're trying to get the word down to the field units manning the checkpoints to clarify who are considered as exempted, meaning the health workers, meaning who work in critical government infrastructure. They should be allowed to come in. I would expect, Ed, by tomorrow, no, we would have cleaned up all these issues. No, today the Joint Task Force COVID Shield, led by General Yazar, is continuing to give instructions to all of the field units so that this situation does not happen again tomorrow.
Yes,
we
sir.
hope to be able to finally get this done with as soon as possible.
Yes, sir. But sir, going beyond the question of identifying who gets to cross the border crossings, is the question of how people are going to be able to move from home to, for example, the hospital, or move from home to a grocery store where they work, and so on down the line. With the lack of transportation or public transportation now, medyo nagkakaproblema sila, for example, getting a ride, going to the hospital, nurses and doctors, for example, who may not have private cars, and people who work in groceries and supermarkets and pharmacies.
Yes, that is the subject of our discussion today, this afternoon, on whether we can give these exemptions to those people. But, I cannot decide for that because the DILG is just one department in the IATF, in the task force. led by Secretary Duque. But Secretary Eduardo Año will definitely raise this matter. If we can, for example, allow private shuttles to operate even on a limited basis to move our health workers from point of residence to point of work. So
Yes, sir.
all of these issues are going to be discussed today at the task force meeting later this afternoon.
Yes, sir. May I also ask you about something that Mayor Vico Soto announced earlier this morning? Sabi ni Mayor Vico Soto, as the mayor, he thinks that he has the authority to allow tricycles to continue plying their routes kasi kailangan doon ng ilang mga tao na nasa essential sector na makapag-move around. In effect, he's saying na sa Pasig pwede ang tricycle at the moment.
Well, that would go against the presidential directive given out yesterday, wherein mass transportation is prohibited. But again, I don't want to go beyond, what I just heard in the media. I think we will need to talk to Mayor Vico personally to find out the exact reasons why he did this. No, I can understand where he's coming from.
Yes, sir.
But if he is to allow tricycles, it cannot be all tricycles. Because
Okay.
allowing all tricycles to operate on the road, it defeats the very purpose of a community quarantine. And people from Pasig, if they go to the next town or the next city, it just spreads the disease faster. So we'll have to talk to him, and have a dialogue with him to be able to clarify the parameters of what he or he cannot do under the state of public health emergency.
Sir, doon po sa mga checkpoints, sa mga border crossings, ano po yung parameters natin? When is somebody going to be arrested, if at all? When is somebody going to be apprehended? And when is he just going to be turned away? I mean, at least as far as law enforcers are concerned, ano yung parameters natin doon?
Well, there's always a possibility of an arrest, but we're not here to arrest people. We're here to ask people to go home.
Yes,
That is
sir.
precisely the reason for the checkpoints. Because if we do not have the checkpoints, people will have this idea that they can freely move around.
Yes, sir.
So the purpose of the checkpoints is to discourage people from going around. So the police officers are going to ask the purpose upon which these people are traveling. So if that person can prove that he is out to get food, or if he's out to he's working in a bank and he needs to go to work, he should be allowed to move. No, he should be allowed to go beyond the checkpoint. So as I said, the protocols are being discussed right now. The president has already issued a memorandum circular to all government agencies. It's just a matter of ironing out the details, and I would expect that by tomorrow, all of these issues would have been clarified.
Okay. Sir, last na lang, promise na.
Okay.
Cotabato City has declared that it is now on lockdown. Can you clarify for us, meron bang kaibahan ng lockdown sa community quarantine at yung pagsisilang borders? And in this case, can an LGU actually impose a lockdown on its own?
Well, an LGU can do so upon advice of the Department of Health. So let me clarify with the Department of Health if they already recommended to the city government of Cotabato for a lockdown. A lockdown is an enhanced community quarantine, which means that people cannot come in and go. That the boundaries of Cotabato City are sealed. So again, let me check again
Yes,
with
sir.
the Department of Health, because if there is no advice from the Department of Health, then I would presume that the mayor went beyond his authority.
Yes,
So
sir.
we will take a look at this issue and investigate further.
Yes, sir. Although may special nature din yung Cotabato, it is part of BARM, which is an autonomous region.
Yes, but it has not yet been turned over to the autonomous region. The Cotabato City, as of now, is still part of the national government. The formal turnover will be on December of this year.
Okay.
So it is not yet under the BARM. So we can still direct the mayor in this during this time of public health emergency.
Okay. Maraming salamat po, Undersecretary Johnson Malaya. Thank you for joining us and thank you for taking our call. We now bring in Jem Abansenya, our News 5 correspondent reporting live from Davao del Norte. Jem, kamusta ka dyan?
Yes, Ed, nandito nga tayo sa isang checkpoint sa Panabo City, Davao del Norte, kung saan makikita nyo sa aking likuran yung authorities na talagang iniisa-isang chinecheck yung mga identification cards ng lahat ng lumalabas at pumapasok ng probinsya. This is in line, Ed, dun sa dineclare kagabi ni Davao del Norte Governor Edwin Hubahib na under community quarantine na ang Davao del Norte except lang sa Island Garden City of Samal na nakaseparate nga doon sa the rest of the cities and municipalities nitong Davao del Norte. And after 24 hours ng pagde-declare nga nitong community quarantine ay magkakaroon daw mamaya ng roadblock dito sa lahat ng entry points ng Davao del Norte. So it means all private and public vehicles are not allowed to go in and out of the province of Davao del Norte. Ed?
Okay, Jem, kasi at least what we've seen in the past few days, different LGUs, mukhang iba-ibang LGU, iba-iba ang kanilang parameters, iba-iba ang kanilang mga guidelines, iba-iba yung kanilang pakikitungo doon sa gaano kahigpit yung kanilang pag-check. Diyan sa inyo, ano ba? Mahigpit ba sila? Paano yung pagbusisi nila ng mga bagay-bagay, yung mga dokumento, and so on down the line?
Ed, sa ngayon daw, since hindi pa, within 24 hours pa naman, hindi pa umaabot yung 24 hours after the declaration. Sa ngayon, ang ginagawa daw ng otoridad, kasi kanina nakausap natin si Colonel Nolasco MP ng 103rd Brigade, chine-check lang daw muna nila yung lahat ng identification cards and kung walang importanteng lakad sa labas ng Davao del Norte, walang official business, ay hindi raw nila papayagan munang lumabas. And sa ngayon daw, ay ang ginagawa nila ay itong information dissemination dahil hindi naman daw lahat ay nakarinig o nakapanood nung pronouncement nga kagabi nito ni Davao del Norte Governor Edwin Hubahib.
Okay, Jem, kamusta naman yung COVID victim natin dyan sa, I think, Davao Regional Medical Center? How's it turning out?
Yes, Ed, according nga sa mga opisyal ng Davao Regional Medical Center sa Tagum City, ay improving itong kondisyon ni patient 130. Ito nga yung 21-year-old Filipina na taga Davao de Oro na may travel history sa Qatar at sa UK. According nga kay Dr. Brian Dalid ng DRMC, ay wala ng sintomas ng COVID-19. Ibig sabihin, wala ng ubo, wala ng sipon at wala ng lagnat. And padala na rin daw sila ng additional or second swab test dahil nga para ma-confirm kung positibo pa rin ba o negatibo na sa COVID-19 itong unang pasyente ng COVID-19 dito sa Davao Region.
So mukhang magaling na for confirmation na lamang.
Yes, Ed. Pero ito nga yung binabantayan ng authorities dito kasi medyo nadagdagan ng yung mga persons under investigation, Ed, kasi nga patuloy yung isinasagawang contact tracing dito nga sa mga nakasalamuhan nito ni patient 130 na nagmula sa UK na bumiyahe ng Qatar. Ed?
Jem, dyan din sa area ninyo, meron din bang curfew of some sort as a result of yung COVID-19?
So far, Ed, ang probinsya na nagpatupad ng curfew dito sa Davao Region ay itong Davao de Oro. 9 p.m. to 5 a.m. yung ipinatupad na curfew. Ito rin ay inanunsyo kahapon ng kanilang local officials. Pero the rest of the province, so far, wala pang curfew na ipinapatupad din.
Okay, and public transportation naman is not yet a problem there? Wala namang ganun paghihigpit dun sa public transportation?
Yes, Ed, wala pa naman so far. Pero yun lang talaga yung mga may problema. Itong mga bus, kasi kahapon, dahil nga may partial lockdown na from Davao City, yung mga public transportation, itong mga bus, itong mga public utility, itong mga vans na galing sa Tagum City, talagang hindi na sila pinapasok. So yung mga pasahero apektado, pinabalik na talaga sila ng Tagum City at hindi na pinayagan pang pumasok ng Davao City. Ed?
Okay, that was Jem Abansenya reporting to us live from the Davao region. Maraming salamat, Jem Abansenya. What we now have is both a stricter quarantine measure that has been expanded from the original borders of Metro Manila to the entirety of Luzon. Now let's take a look at the parameters of this expanded and enhanced quarantine or community quarantine. It all began March 15 with what was called the community quarantine for Metro Manila. Now, Metro Manila is the national capital region with 16 cities and one town. It has a population of 13 million during the night, but come daytime, the population expands to up to 16 to 17 million. Now, with the new measure in place, we have a total lockdown or quarantine of the entire island of Luzon, not just the mainland island, it turns out, but as well the other outlying political areas of Luzon, which would include the Batanes group of islands, Catanduanes, Palawan, and as well Mindoro. And the population of that area is now 53 million as of the 2015 census by the Philippine Statistics Office. Authorities are now guarding possible routes between Luzon Island and the rest of the country. For example, a favorite Roro port is Matnog Port in Sorsogon, where you usually have a lot of traffic coming in and out for the ferries. So Matnog Port in Sorsogon is one area. The other area that people have to watch out for is the Batangas port, which usually has access to, for example, Mindoro and further down south. Now, as you can expect, you will have authorities locking down on these ports and as well as on other ports that service the southern part of Luzon. Now, with expanded community quarantine, we're looking at this. Land, sea, and air travel has been suspended. International outbound flights will only be available for the next 72 hours. So foreigners who plan to leave the country have to leave within 3 days. Otherwise, they lose their chance for an entire month. As well, movement of cargo will have to go on unhampered. Uniformed personnel, medical supplies, and humanitarian services will still be allowed to use land, sea, and air travel. So these are the exemptions. We also have strict home quarantine, which means that everybody else has to stay at home. You're only allowed to leave to access basic needs like food and medicine, and only one person at a time for each household is allowed to leave. The government is now encouraging work from home scheme, especially for the executive department, and it expects the judiciary and the legislature to also follow suit. Public transportation has been suspended throughout the entire Luzon area. No MRT, no LRT, no PNR, no taxis and jeeps, no public utility buses, no TNVS, so that means no Grab, no Auto, no Angkas, and it looks like there's as well there are no food delivery services also operating. And as we heard now, just a few minutes ago from USEC Jonathan Malaya, even tricycles are not supposed to be plying the routes, even though, well, the Pasig City Mayor has said that they still plan to allow tricycles to ply the routes. Establishments are to remain closed, especially retail establishments and malls. So these are the exceptions. Exceptions are for markets, supermarkets, groceries, convenience stores, hospitals, clinics, pharmacies, food preparation and delivery services. This means that restaurants are allowed to remain open. However, no dining is going to be allowed. These restaurants are only to function as food preparation areas, and the food is supposed to be delivered to people around Metro Manila and, well, actually the rest of Luzon. Manufacturing processing plants for food and medicines are also exempted, as well as power, water, and telecommunications utilities. However, government is asking these establishments to put in place only a skeletal force and not to have a full force in place. Establishments, all establishments are closed except for business process outsourcing, export-oriented industries, banks, and the media. The media is expected to apply for special accreditation within 3 days. Affected workers and residents. Here you have a lot of people who may not be earning money because they're not allowed to travel around, and they're not allowed to do non-essential, what government calls non-essential work. And these are also the people who may not have private vehicles to move around. So in response to that, the Department of Social Welfare and Development and the Department of Labor are expected to formulate programs for social amelioration. This includes the distribution of food and food packs, and this may include a moratorium on rentals and leases, and the advancing of prorated 13th-month pay, and a reprieve on the payment of bills and assistance for micro, small, and medium-scale enterprises. Now, the government is requesting local leaders to lend official vehicles so that they can be used to ferry essential workers. The Department of Transportation is also urging private businesses to provide transport services for their employees. Meanwhile, Trade Secretary Mon Lopez is suggesting to companies that they provide workers with temporary housing or lodging near their workplaces. He also reminds business owners to limit customers who can enter their establishments. According to Lopez, there should only be one person per square meter inside the store at any given time. And moving on to the latest COVID-19 numbers in the Philippines via the Health Department's tracker. Okay, here you see the map of the Philippines. The center of the infection, of course, is in Metro Manila. But you have pockets elsewhere, like here in Ilocos, you have one. And a case in Dumaguete, a case in Northern Mindanao, and as well a case in Davao City. However, most of the infections were detected here in Metro Manila. Well, virtually all of them actually. You have 142 confirmed cases, and you have, I understand, 12 deaths already. Now, let's look at how the crisis has grown in the last few weeks. If you can see this graph, the blue line going up very steeply is the rate of infection. The rate of infection started moving very, very steeply beginning March 7 up to March 16. You can see how the line has climbed in an unusual way. The red line is the rate of deaths. It's not as steep as the rate of infection. Okay, if you check this graph over here, you will see who are the biggest victims of the infection. These are people aged 61 to 70, followed by people aged 41 to 50, and thirdly, people aged 51 to 60. The group with the smallest number of victims belong to the group that are aged between 11 to 20 years old. And one more graph here, we have the distribution of infections by area. Quezon City remains to be the biggest, to have the biggest in terms of percentages. Quezon City has 15.5% of the number of infections, followed by San Juan City with 11.3%, and Makati City with 9.96%, and Pasig City with 7.7%. So that's a quick look at the situation in the Philippines as far as the COVID-19 is concerned. Let's look at the global situation via this interactive map of Johns Hopkins. Ito po, nakikita natin with the world map is abloom with red, with the center of gravity of the infection being in China, followed by Europe and then North America. The Philippines, of course. Oops. There. Sorry. Failure to aim. Philippines with one big red dot over there. Total confirmed cases, 181,127. Total confirmed deaths, 7,114. That amounts to a mortality rate of around 3.9%. Total recovered is around 78,085. That's around less than half have already recovered from this infection. Bulk of the infections are still, of course, in China with 81,000, followed by Italy, Iran, Spain. South Korea remains the only Asian city in the top 10, then followed by Germany, France, US, Switzerland. Japan is way down there, followed then by Malaysia with 566. That's a quick look at the infections throughout the world. That's the latest on the enhanced and expanded community quarantine in Luzon. For more updates, follow News 5, The Philippine Star, and Business World Online. I'm Ed Lingao. We are One News.